my name is Dr. Lindsay with Healthy Motives 365, and today I want to show you a few exercises you could do to help treat a very common postpartum condition called diastasis recti. Diastasis recti is separation of the abdominal muscles, and this is very common after pregnancy. Ideally, once the baby is born, the muscles should come back together, but in some cases we can be left with a rather large gap. Now there are options for you. You can get this treated. So for official diagnosis, you always want to consult with your doctor, and you also want to consult with your doctor before starting any type of postpartum exercise regimen. So today I'm going to show you a self-test, and what this does, it helps you assess to see if you may possibly have diastasis recti. I'm also going to show you 4 exercises you can do to help strengthen your core, specifically your transverse abdominis muscles. These muscles are your body's natural corset, so it helps to cinch in the waist. And so by doing these exercises and doing them consistently, it can help to close that gap. But like I said, before you start an exercise regimen after having a baby, you want to make sure you consult with your physician, and also for official diagnosis, make sure you consult with your doctor. So let's go ahead and get started. Alright, so the first exercise is the abdominal draw-in. So essentially what you're going to do is lay flat on your back, and you're going to take a deep breath, and then you're going to exhale, and then you're going to hold it. So it's like you're pulling in your belly button to your spine. So I'm going to take a deep breath. The goal is to try to hold it for 10 seconds. So again, I'm going to take a deep breath, and then I'm going to blow it out. And then I'm going to engage my core. So the whole point with this one is to tighten your core in. Alright, so the next exercise we're going to do is a very simple pelvic tilt. So ideally what you're doing is you're moving your hips up towards your ribs. So it's kind of just a tuck of the pelvis. So right now you may not be able to see, but there's a little bit of an arch in my back. So what I'm doing is flattening out my back, and I'm tucking my pelvis. Okay? So you're just going to do this a couple times here. So I'm going to tuck, hold for a couple seconds, and then release, tuck, and release, and tuck, and release. You want to make sure that you are again engaging your core. It's kind of like you're bracing yourself for somebody that's like about to punch you in your stomach. I know that's a little dramatic. So again, pulling your spine, pulling your belly button in towards your stomach. Okay. The next exercise we're going to do is a heel slide. So all you're doing is you're going to put your hands to your side. You're going to engage the core, and I'm simply just going to slide my heel out. Slide my heel out. Making sure that pelvis is tucked, the back is flat on the ground, and you have your core engaged. And of course you want to do this on both sides. Alright, so this is called a heel slide. Alright, so the next exercise we're going to do is a heel tap. So all you're doing is you're going to bring one leg up, and you're going to bring it down. Okay? So again, you're just tapping, bringing up, bringing it down. Making sure to keep that core engaged. Alright? Of course, you also want to alternate and do both sides. Now a more advanced version of this is having both legs up, and then you alternate between the two. But again, this would be a little bit more advanced, so if you're just starting off, you're going to want to start off with just tapping one heel at a time.